Hello, Christy. My name's Andre. I met with you a couple weeks ago for
Right.
your well visit, and I'm here now. Just want to let you know that we're just going to do like an assessment of your head, your neck, your ears, your eyes, your throat, your skin, and your nails. Is that okay?
Yeah, sounds good. Thank you.
All right, and it should take about 10 to 15 minutes, okay?
Okay.
So as I'm here right now, what I'm going to do is I'm just looking for your overall skin appearance, your color, uniformity, symmetry. You have good hygiene. I don't notice any odors or smells. There's no lesions, primary or secondary. I'm going to just feel the skin.
Okay.
It feels warm. It feels dry. Um, and then just looking at the nails also. Nails look good. I'm looking at pigmentation, the length, the symmetry, surface changes, any redness or swelling. Is there any pain when I press?
No.
All right, no exudate, warts, cysts, or tumors. I'm going to measure the nail base. It's about 1/4 of an inch, which is good. And I did notice that there is no clubbing, which would be a sign for chronic hypoxia.
Oh, okay.
Texture is good. There's firmness. The thickness is normal. There's uniformity, adherence to the nail bed. Also checking for the cuticles, for color, vasculature, and integrity. Now also looking through your overall presentation, just looking for anything that has like a size, shape, color, texture. I'm not noticing any growths anywhere, no exudates, no elevations or depressions. And then moisture is good, skin is dry, temperature is warm, texture is good, turgor is good. I'm feeling for tenting. It doesn't appear that you're dehydrated. That is good. You have good elasticity.
Good.
And then also just looking at the head and looking at the hair. Hair is brown with like blonde highlights. Distribution is even. I don't see any patches. It doesn't look like there's any hair that's missing, and it does look to be thick and healthy.
Good.
All right, and then going on from that, we're going to be doing your head and neck inspection.
Okay.
So I'm looking midline. Your head is midline. It's not wavering off to one side or the other. It looks like you're not tilting any which way. No tremors noted. I'm just going to look at your scalp and your skull for symmetry and shape. Palpate. I don't feel any areas of concern, no soft spots, no lesions, no trauma, and skull size does appear to be normal for this population. Looking at the facial symmetry, the shape is regular. It doesn't look like anything is leaning more to one side or the other. No unusual features. Pigmentation is normal. Does look like there are some areas of like sunspots that I will, of course mark that down. But everything does look good from that. No facies, no tics noted. I'm gonna feel above, this is the frontal and maxillary sinuses. Do you have any pain when I palpate here?
No.
All right, so it doesn't look like there's any swelling or any drainage coming from that area. From the maxillary sinus or the mastoid process area, and it does have patency without any tenderness. Scalp symmetry, we kind of checked for that before. I didn't notice any, if I pull the hair back, it does look like the follicles are evenly distributed. The texture is thick, hair is coarse. Don't notice anything with that, and distribution appears to be normal. And move down to the inspection of the neck. I'm looking here as again, I do see neck symmetry, fullness. We do want to test for range of motion. If you could look to your left for me, good. And then look to your right, good. Any pain with that?
No.
All right, and then look up for me, and then look down. All right, very good. So no pain at all when you move your neck? All right, no. That's good. So just looking at her trachea, just for protrusion or tugging, I don't see any asymmetry. We also want to check for the thyroid. So we're going to check here, go down to feel the thyroid cartilage. Right underneath is her thyroid. Now to check for this, we're just going to go back here, and I will be feeling and palpating your thyroid using about 3 fingers The thyroid does appear to be normal, round. I don't see any or feel any protrusions. I don't feel any nodules, any cysts, any lesions. It does appear to be normal. Any problems with swallowing?
No.
All right. If you could, I'm just going to have you hold this for me. And then again, when you swallow, I'm just going to have you palpate.
Okay.
All right, go ahead. All right, it does feel to be midline. It feels to be in the center where it should be, so that is good. And then what also I'm going to do is I'm going to palpate and feel your other, your lymph nodes, okay?
Okay.
So we want to feel periauricle and then postauricle, occipital, your sternocleidomastoid, submandibular, submental lymph node, your anterior neck deep lymph nodes. You're using about 3 fingers in a circular motion to feel for any tenderness, abnormalities. These should be small, they should not be swollen, they should be soft. If they're hard, that could be a concern for something going on. Post-cervical and then occipital, you can actually feel when you go back here to feel the occipital lymph nodes. Again, I don't feel anything, no tenderness. Are you having any pain with any of that palpation?
No.
All right, good. And then of course you just want to feel supra and inferior supraclavicular for those lymph nodes, just using 2 to 3 fingers in like a circular motion. I do not feel anything abnormal there. The next thing we want to do is do the auscultation of the areas for the head and the neck areas. So what I'm going to do is going to use my stethoscope here. I'm going to be using the bell because that does help with higher frequencies. And we're going to be checking the temporal artery for any bruitings. So what I'm going to do, I'm going to place here. All right, I don't hear anything. And then on the other side. All right, I don't hear anything. And then we're also going to be checking over the eyes for the bruise. So if you could close your eyes for me. All right, I don't hear anything there. It is negative for bruit on the left and negative for bruits on the right. And then we also want to check the thyroid. So what I'm going to do is I'm just going to have you look up a little bit. I'm just going to check here. I'm going to check on either side. All right, so negative on the left for carotid bruit, negative on the right for carotid bruit, and then negative for the thyroid. And then what I'm going to do is I'm going to palpate for the temporomandibular joint for any crepitus. So what I'm going to do, I'm going to have my hands right here. Just open your mouth for me. All right, and close. All right, did you have any pain with that?
No.
All right, so I did palpate that, didn't notice any crepitus or pain with palpation. All right, and the next one we're going to do is the eye examination. So what I'm going to do, this is called a Snellen chart that we use. It's just going to test your vision, okay? So what we're going to do, normally you would have this about 20 feet away, but for this video, we'll just have it up close. What I'm going to have you do is cover your right eye, all right? And then can you read the lowest line that you can see?
Okay. LTFPH.
All right, very good. And then I'll have you do the other eye, cover that left eye, and then read the lowest line that you can.
LTPFH.
All right, very good. All right, so your vision is 20/20, which is good. And then what we're going to do is we're also going to test your confrontation. So we're going to have you cover with this, cover your right eye.
Okay.
And then I'm going to hold up some numbers and just tell me what number you see.
2.
All right, good.
2.
All right.
2. 1.
All right, very good. And then I'll have you just switch that to the other eye. We'll test the other eye for this. All right, and then just tell me what numbers you see.
2. 3. 2. 1.
All right, very good. All right, so she did pass for that, so that's good. And then what we're going to do is just the overall inspection of the eyes. So just looking at the eyebrows, they are symmetrical. The hair does look evenly distributed. She does have, looks like she has a cyst on the left upper eyebrow. So just looking at the orbital area, her eyelids, I'm not seeing any ptosis or drooping. No fasciculation, so no brief symptoms of contraction. I'm not seeing any tremors, flakiness, redness, or swelling. What I'm going to do, I'm just going to check the conjunctiva in your eye. It does appear to be pink, moist, clean. I don't see any foreign bodies, no styes, growths, or anything like that noted. No discharge, no pterygium. The lacrimal gland punctum looks to be intact,
Okay.
and everything does appear to look good. Not having any pain or anything with your eyes?
Nope, nothing.
All right, very good. So what else? We're going to look at the corneal clarity and sensitivity, arcus, and then color of the iris. Her iris does appear to be brown, and her pupils do appear to be a 5 left and right, so 5 millimeters for each. Pupillary size and shape are good. We're going to check response to light. Good. All right, eyes are reactive to light and accommodation, and afferent pupillary defect, none of those noted. No nystagmus or astigmus, and then we are going to do accommodation, so just look straight right here.
Okay.
All right, good. And then no strabismus noted, and lacrimal gland condition does appear to be intact as well. We're also going to check extraocular eye movement. So we're going to be doing the corneal light reflex. So what I'm going to be doing is I'm going to shine this light into your corneal, and we're going to see if there's your eye alignment, okay?
Okay.
All right, good. So that is good. All right, everything looks good. And then we are going to do the 6 fields of cardinal gaze. I'm just going to have you follow this pen here, and it's just with your eyes only. Do not move your head. We are testing cranial nerves 3, 4, and 6, along with her muscle movement. All right, good. So we'll do that.
Okay.
And then with this, we're going to be doing an inspection. So we want to hold this with the eye. We want to hold the ophthalmoscope in the hand that corresponds to the examining eye. So what I'm going to be doing is I'm going to be looking in your left eye. I'm going to be using my left eye to look in. All right, good. And then if you could turn your head this way a little for me, I'm going to use my right eye to check her right eye. All right, good. So I noticed that there is, the lens clarity is good. It doesn't appear to be opaque or any problems with that. I did see the red reflex with the cornea. It's bright, symmetrical, and it's like a reddish orange glow, which is normal, what we want to know. Retinal color is good and no lesions. The blood vessels in the back of the characteristics, I noticed that the veins are larger than the arteries. I did not see any AV nicking or cotton wool spots when I looked in her eyes. Disc characteristics appear to be normal. No changes in size, shape, or color that I have noticed. Macular changes, we want to have the patient look directly at this light. All right, look directly at the light.
Okay.
Good. All right, good. So no changes with macular. It does appear, and you're not seeing like any spots or anything in your vision?
Nope.
All right, good. So depth of the anterior chamber, what I'm going to do here is I'm just going to shine my light on the side of the eye until it fully illuminates the iris.
Mm-hmm.
All right, good. I don't see any cloudiness, which means that the chamber of the iris is likely normal. We're going to do the right side. All right, and I don't see any cloudiness or haziness in that eye either. The ears now, I'm looking at her left ear here. I do want to palpate it. I don't feel any lesions, auricles in the mastoid area, the site, shape, symmetry, landmarks. Color is normal. They do appear to be pink with some slight redness. It does look like her ears are pierced. No deformities or lesions. And then palpate, noting any tenderness, which I do not feel, no swelling or nodules. Next, what I'm going to do is I'm going to use my ophthalmoscope or my otoscope, and I'm going to have the handle up, and I'm going to pull her pinna or auricle up and back, and just looking in the ear. All right, good. So I'm looking in the ear for any cerumen, which I do not see. There is no earwax in here, no discharge, foreign bodies, no lesions, no cracks, no redness. Tympanic membrane looks pearly white looks good. The contour looks good, no perforations, and mobility looks normal. Of course, I would come over here and do the same to the right ear, pull up and back. Looking at the right ear, everything looks normal. Landmarks are good, contour is good, no perforation. Tympanic membrane looks white and glossy. All right, so what we're going to do next, this is called the Webbing test. And what I'm going to do is this is testing your hearing. And which ear do you hear it out of?
Both.
All right, very good. And the next one is going to be the Ryan test. I'm going to hit it. I'm going to put it on her mastoid process bone. And tell me when you don't hear it anymore.
Now.
And do you still hear it?
Yes.
All right, very good. And we will check this on the other side. Do you hear it? Tell me when you don't hear it.
Now.
And do you hear it?
Yes.
All right, so that does mean that bone air conduction is 2 times longer than bone conduction. And then next we're going to do is the whisper test. So I'm just going to have her occlude her left ear with her finger, and I'm just going to say a 2-syllable word, New York.
New York.
All right, very good. And then we'll have you do the other ear.
Oh.
And then
Grapefruit.
all right, very good. All right, so next after that, what I'm going to do is I'm just going to check the nose. I'm looking for size, shape, color. It does look symmetrical. I am going to palpate for any tenderness, bone cartilage displacement, any masses. I am going to look at the patency of NURS. I'm going to have you look up for me.
Mm-hmm.
I'm looking in each nostril in the NURS here. The nasal mucosa, septum, color, alignment. There's no discharge, no swelling of the turbinates, and there's no perforation. And then I'm going to be feeling frontal and maxillary sinuses. For tenderness, any swelling, which I do not feel, those both appear to be negative. All right, and then I will be looking at her lips. Skin color, symmetry, they do appear to be pink, symmetrical, no chapping, no cracks. If you could open your mouth for me. All right, teeth appear to look good. No occlusion, no caries or tooth decay, loose or missing teeth, or any surface abnormalities. I'm just going to look in your mouth here. All right, say ah. Very good. Gingivae and buccal mucosa are pink, moist, and clean. I do not see any lesions, no cuts, no scrapes, no masses, nothing concerning. Tongue color is pink and moist. It is midline, no ulcerations. Uvula and palate are also clean, moist, pink, and look well. And tonsils in the back, say ah for me, please. All right, good. Tonsils are good, present on both sides. I do not see any inflammation or any spots with that. And I just would make sure that they had a gag reflex also.